White nurse failed to heal burned child. Then Lakota medicine woman opened her sacred bundle. The accident happened on a quiet afternoon, the kind of day that usually passed without leaving any memory behind. In a small home on the edge of a reservation town, a young child was playing near the kitchen while an older family member prepared food. No one expected anything to go wrong. Life felt ordinary, familiar, and safe. In just a few moments, that calm broke. A pot tipped, hot liquid spilled. The child cried out in sudden fear and pain. The sound froze everyone in place for a second that felt too long. Then the room filled with movement, voices shouting for help, hands rushing to lift the child, water running, someone calling for a ride, panic mixed with love and guilt, the kind that arrives instantly when something terrible happens to someone small and helpless. The family did what they could before help arrived. They wrapped the child gently, whispered prayers, and tried to stay calm even as their hearts raced. Within minutes, the child was on the way to the nearest hospital, carried by adults who were trying not to let their fear show. The hospital stood miles away, a large building of pale walls and bright lights. For the family, it was a place they rarely visited unless absolutely necessary. When they arrived, everything moved quickly. Doors opened and closed. Forms were signed. The child was taken from their arms and placed on a bed that rolled down long hallways. A white nurse was among the first medical workers to take charge. She had worked in this hospital for years and had seen many injuries. She was trained, careful, and proud of her profession. To her, this was a case that required focus and routine. She spoke in a calm voice, giving instructions to others, checking the child's condition, and making sure every step followed hospital rules. The child was cleaned, examined, and wrapped in fresh dressings. Medicine was given to reduce pain and prevent infection. Machines beeped softly in the background, measuring heart rate and breathing. The nurse explained the situation to the family in clear medical terms, using words she had learned in training. But while her words were calm, the family felt lost. They stood close together near the wall, holding coats and bags, watching their child lie still under bright lights. The smell of cleaning chemicals filled the air. The room felt cold, even though it was warm. Everything looked unfamiliar. Machines, tubes, white sheets, sharp corners. This place did not speak their language, not just in words, but in feeling. The child cried quietly at first, then became silent. Eyes that were once curious now looked tired and distant. The nurse noticed this and thought it was normal. Children often reacted this way after accidents, she believed. The body needed rest. Healing would come with time. The family, however, felt something else was wrong. They whispered among themselves in their own language, speaking softly so they would not disturb the staff. To them, the child did not just look hurt in body, but shaken inside. The accident had come suddenly, and in their belief, sudden fear could cause a part of the spirit to pull away. They wanted to pray properly, to bring comfort in the way they knew best. But the hospital room did not feel like a place for prayer. When one family member tried to sing quietly, a staff member asked them to stop, saying it might disturb other patients. When another placed a small personal item near the child, a nurse moved it aside, explaining that only approved objects were allowed near the bed. The white nurse did not mean to be unkind. She believed she was protecting the child. To her, rules existed for safety. Still, each small action created more distance between the hospital staff and the family. Hours passed. Then, a full day. The child remained in the hospital bed, mostly silent. Nurses came and went, changing dressings, checking temperature, giving medicine on schedule. On paper, everything looked fine. There were no signs of infection. The injury was being treated exactly as medical training required. Yet something felt wrong. The child refused food when it was offered. When a spoon touched their lips, they turned away. At night, sleep came only in short moments. The child would wake suddenly, eyes wide, breathing fast, as if startled by something unseen. The white nurse noticed these signs and wrote notes in the chart. She spoke with doctors, suggesting adjustments in care. Perhaps the pain medicine needed to be changed. Perhaps the child was simply frightened and needed more time. She stayed professional, but inside, a quiet frustration grew. She had followed every step correctly. She had done what she was taught. Still, the child was not improving the way she expected. The family felt that frustration too, but in a different way. They sat by the bed in turns, holding the child's hand, brushing hair from the child's face. They spoke gently, telling familiar stories, reminding the child of home, of grandparents, of open land and warm fires. Sometimes the child responded with a small movement or a soft sound. Most of the time they remained still. The family asked questions that the nurse found difficult to answer. "Why does the child look empty?" one asked quietly. "Why is the body here, but the spirit feels far away?" The nurse did not know how to respond. She explained again what the chart showed, how healing took time. She avoided the deeper meaning behind their words, not because she did not care, but because she did not understand. As night fell on the second day, the hospital grew quieter. Lights dimmed, footsteps softened. The child lay awake, staring at the ceiling. The nurse, checking in one last time before her shift ended, paused by the bed. She saw something she had not noticed before. The child was not crying. The child was not sleeping. The child looked as if they were waiting, tense and unsure, like someone far from home. For a brief moment, the nurse felt an uncomfortable thought cross her mind. What if medicine alone was not enough? She pushed the thought away. Training told her to trust the process. Still, as she walked out of the room, the image stayed with her. Behind her, the family continued to sit quietly, holding on to patience, faith, and a growing sense that something important was missing. This was only the beginning of the story. When two different ways of understanding healing stood side by side in the same room, unsure how to reach each other, while a child lay between them, needing more than anyone yet realized. The next morning arrived slowly, as if the night itself was tired. Pale light slipped through the hospital window, touching the child's face without waking them. The machines continued their soft sounds, steady and patient. Nurses moved through the hallway, their shoes making quiet steps that echoed like reminders that time was still moving forward. The white nurse returned for another shift. She checked the chart before entering the room and paused for a moment. On paper, everything still looked acceptable. The numbers were stable. The injury showed no new problems. Yet the notes from the night shift mentioned the same concerns again. Poor sleep, little appetite, no real response. When she walked in, the family was already there. They sat close to the bed, speaking softly to one another. Their faces showed signs of long hours without rest. Eyes were heavy, shoulders tense, hands folded together as if holding on to something invisible. When they noticed the nurse, they nodded politely, but there was a quiet distance in their expressions. The nurse greeted them and began her routine. She checked the bandages, asked gentle questions, and spoke in a calm voice. She tried to sound reassuring, but she could feel that her words were not reaching them the way she hoped. The child stirred slightly as the nurse adjusted the blanket. For a brief moment, their eyes opened. They looked around the room, then at the nurse, then at their family. There was no fear in their eyes, only a kind of sadness that was hard to explain. The nurse felt it again, that strange feeling she had tried to ignore the night before. She offered breakfast a little later, explaining that food would help the body heal. The family encouraged the child too, smiling gently, whispering comforting words. But the child turned their head away, lips pressed together. After a few tries, everyone stopped. Silence filled the room. The family began to talk more openly among themselves. Their voices stayed low, but emotion crept into their words. They spoke about how the child had changed since the accident, how the laughter was gone, how the child no longer responded to familiar voices the same way. They spoke of balance, of fear entering suddenly, of how healing was not only about skin and flesh. The nurse heard these words but struggled to understand them fully. She had been trained to listen for symptoms, not stories. Still, she could tell that what they were saying mattered deeply to them. At one point, an older family member asked a careful question. They wanted to know if there was room for prayer, for quiet singing, for something familiar that might bring comfort to the child. The nurse hesitated. Hospital rules were clear. Certain activities were limited. She explained this gently, choosing her words with care. She said she understood their wish, but she had to follow guidelines meant to protect all patients. The family listened without interrupting. When she finished, they nodded again. But the air in the room felt heavier than before. As the day went on, small moments of tension appeared. A family member placed a symbolic item near the child's pillow, something simple and meaningful. Another nurse came in later and moved it away, saying it could not stay there. No harsh words were spoken, but the message was clear. The family felt pushed aside. The nurse noticed this and felt uncomfortable. She did not see the family as difficult. She saw them as worried, tired, and deeply connected to the child. Yet she also felt caught between her role and their needs. She had been taught that care meant control, order, and safety. This situation did not fit neatly into that frame. By the afternoon, the child became restless. Their breathing quickened at times, even though there was no physical reason. They clutched the blanket tightly, as if holding onto it was the only thing keeping them grounded. The nurse checked the monitors again and again. Everything still looked fine. She adjusted the medicine slightly, following doctor's orders. She expected some change, some sign of progress. But it did not come. The family grew more concerned. One of them finally spoke directly to the nurse, asking why the child seemed to be getting weaker instead of stronger. The question was not angry, but it carried weight. It carried fear. The nurse answered honestly. She said healing could take time. She said the injury was serious but manageable. She said the body sometimes needed patience. The family listened, but their faces showed doubt. To them, patience had already been given. Something else was needed. That evening, a doctor joined the nurse in the room. He reviewed the chart, examined the child, and spoke confidently. From his point of view, the treatment was working. There was no reason for alarm. When the doctor left, the room felt emptier than before. The nurse stayed behind, watching the child for a moment longer than usual. She noticed how the child's hand relaxed only when a family member held it, how their breathing slowed when familiar words were spoken, how the machine seemed less important than the quiet presence around the bed. For the first time, the nurse wondered if healing might mean different things to different people. She remembered her training, how little it had prepared her for moments like this. She had learned how to treat wounds, not how to bridge worlds. She had learned about the body, not about belief. Late that night, the family gathered close and spoke among themselves again. This time, there was a new tone in their voices, one of decision. They talked about elders, about someone who understood how to help when fear had gone too deep. They spoke about a medicine woman, respected and wise, who carried knowledge passed down through generations. The nurse overheard pieces of this conversation as she entered to check on the child. She did not interrupt. She only listened. When the family finally spoke to her, they chose their words carefully. They asked if it would be possible for someone important to their traditions to visit. Not to replace medical care, they explained, but to help in a way that the hospital could not. The nurse felt a tightness in her chest. This was not a request she handled every day. She did not say no. She did not say yes. She said she would need to ask. After leaving the room, she stood in the hallway longer than necessary. She thought about the child's quiet eyes, the family's patience, and her own growing sense of doubt. She thought about how healing might not be a single path, but many paths moving side by side. When she finally walked toward the nurse's station to speak with her supervisor, she knew that something had already shifted. The walls between medicine and tradition were still standing, but small cracks had begun to form. The next day carried a different feeling, though the hospital looked the same as always. The floors were still clean, the lights still bright, and the machines still made their steady sounds. Yet for the family and the nurse, something had already changed inside. Early in the morning, the nurse spoke with her supervisor. She explained the situation carefully. She talked about the child's slow recovery, the family's concern, and their request. She chose her words with care, making sure it was clear that the family was not asking to stop medical treatment, only to add something meaningful to them. The supervisor listened quietly. He had worked in the hospital long enough to know that not all healing followed the same path. After a pause, she agreed to speak with administration and review what could be allowed. The wait felt long. Back in the room, the family stayed close to the child. They spoke softly, telling gentle stories about home, about open skies, familiar voices, and places where the child once felt safe. The child listened, eyes open but distant, as if hearing these words from far away. When the nurse returned with news, she kept her voice calm. She explained that with certain conditions and respect for hospital rules, the visit could happen. It would need to be quiet. It would need to be limited in time. And it would need to be understood as support, not replacement. The family's faces changed in an instant. Relief passed through them like a warm breath after a long hold. They thanked the nurse again and again, not loudly, but with deep feeling. One of them stepped out to make a call. The rest of the day passed slowly. The child slept for short periods, waking and resting again. The nurse continued her duties, but her attention returned often to this room. She found herself wondering what would happen next. Part of her felt curious. Another part felt unsure. She trusted science, but she could no longer ignore what she had been seeing. By late afternoon, the visitor arrived. The medicine woman did not come with noise or attention. She walked quietly through the hospital doors, her presence calm and steady. She was older, with eyes that seemed to notice everything without staring. In her hands, she carried a small bundle, wrapped with care. The family greeted her with deep respect, their voices low and full of trust. When she entered the room, the air seemed to change. Nothing physical shifted at once. The machine still hummed. The light still shone, but the tension that had filled the space for days softened, like a tight knot slowly loosening. The medicine woman stood near the child for a moment without speaking. She looked at the child's face, then at the family, then at the nurse. Her gaze was calm, not judging, not questioning. She nodded slightly, as if understanding something without words. She spoke quietly to the family, asking about the accident, about the child before it happened, about changes they had noticed since. The family answered carefully, each adding a small piece to the story. They spoke of fear, of silence, of how the child no longer felt fully present. The nurse stood nearby, unsure where to place herself. She did not want to interrupt, but she did not want to seem distant. She watched closely, noticing how gentle the medicine woman's movements were, how patient her listening was. The medicine woman explained that sudden shock could cause a person, especially a child, to pull inward. She said that healing the body was important, but helping the child feel whole again mattered just as much. Her words were simple, spoken without force. When she opened her sacred bundle, she did so slowly and with respect. She did not display its contents openly or dramatically. Everything she did was quiet, careful, and intentional. The ceremony itself was gentle. There was no loud sound, no movement that disturbed the room. She spoke soft prayers, using words that carried meaning for the family. She sang quietly, her voice steady and warm, like a lullaby meant to guide rather than command. The nurse expected to feel uncomfortable. Instead, she felt still. She watched the child closely. At first, there was no reaction. Then, slowly, the child's breathing changed. It became deeper, more even. The tight grip on the blanket relaxed just a little. The family noticed it too. One of them wiped away tears, careful not to draw attention. Another leaned closer, whispering the child's name. The child's eyes, which had been distant for days, began to focus. They moved from the ceiling to the medicine woman's face, then to their family. It was not a sudden change. It was a small one, but it felt important. The nurse felt her chest tighten, not with fear but with something close to wonder. She reminded herself to stay grounded, to observe without jumping to conclusions. Still, she could not deny what she was seeing. After the ceremony ended, the medicine woman spoke again, reminding everyone that healing was a process. She thanked the hospital staff for caring for the child's body and asked that the family continue to support the child's heart and spirit. She did not stay long. Before leaving, she touched the child's hand gently. The child did not pull away. After she was gone, the room felt quieter than before, but not empty. The family stayed close, speaking softly. The nurse checked the monitors again. Everything remained stable, but something else had shifted beneath the surface. That evening, the child asked for water. It was the first request they had made since arriving at the hospital. The nurse brought it quickly, helping the child take small sips. The family watched closely, hope flickering in their tired eyes. Later, the child accepted a few bites of food. Not much, but enough to matter. As night came, the child slept longer than before. Their breathing stayed calm. Their face, once tense, now looked peaceful. The nurse sat at the station writing notes, but her thoughts stayed with the room down the hall. She thought about how easily she had once dismissed things she could not measure. She thought about how care could look different without being wrong. She did not suddenly abandon her training. She did not stop believing in medicine. But she understood now that healing did not always arrive from one direction. Behind the hospital walls, two ways of knowing had met quietly, without conflict. And between them a child had begun to return. Not all at once, but step by step, breath by breath, toward balance again. The days that followed felt quieter, but not in the heavy way they had before. It was a softer quiet, the kind that comes when worry loosens its grip just a little. The hospital room still looked the same, yet the feeling inside it had changed. The child woke up the next morning with eyes that seemed more present. When the nurse entered to check on them, the child looked at her instead of past her. It was a small moment, easy to miss, but the nurse noticed. She smiled without thinking, and the child did not turn away. The family noticed everything. They noticed how the child held their hand with a little more strength. They noticed how the child listened when spoken to, even if they did not always answer. They noticed how fear no longer filled the room the way it had before. The nurse went through her usual routine, checking bandages and noting progress. This time the changes were clear, even on paper. The skin was responding better. The body seemed less tense. The signs she had been waiting for were finally appearing. Still, she knew that what had shifted could not be explained by numbers alone. Throughout the day, the child began to speak more. At first, it was only a few quiet words. A question about the window, a request for a blanket to be adjusted. Each word felt like a step forward, and each step filled the family with careful hope. The nurse encouraged these moments gently. She spoke more softly than before, less rushed. She found herself slowing down, paying closer attention not just to the injury, but to the child as a whole person. Other staff members noticed the change too. A doctor commented that recovery seemed to be moving along better now. Another nurse mentioned how calm the room felt compared to earlier days. No one said much more than that, but there was a shared understanding that something had improved. The family continued to support the child in their own way, within the space allowed. They spoke familiar words, told gentle stories, and stayed close. They did not ask for anything more. They felt that what was needed had already begun. The white nurse thought often about the medicine woman. She replayed the visit in her mind, not as something mysterious, but as something human. She thought about how carefully the medicine woman had listened, how she had treated fear as something real, not something to be ignored. The nurse realized that in her training, fear was often seen as a problem to manage, not something to understand. That realization stayed with her. One afternoon, as she changed the dressing, the child asked a quiet question. They wanted to know when they could go home. The nurse answered honestly, explaining that it would take a little more time, but they were moving in the right direction. The child nodded, seeming to accept this. Then they asked if their family would stay. The nurse looked at the family standing nearby and said yes. The child closed their eyes and rested. Later that day, the nurse spoke privately with her supervisor. She shared what she had observed since the visit. She did not try to explain it away or turn it into something it was not. She simply described the changes, both physical and emotional. Her supervisor listened and nodded. She reminded the nurse that hospitals were meant to care for people, not just conditions. Sometimes that meant learning from those they served. The nurse felt a quiet sense of relief. As the days passed, the child's strength continued to return. They ate small meals more regularly. They slept through longer stretches of the night. Their voice grew stronger, their movements more confident. The family allowed themselves to breathe again. They spoke about home more often now, not as something distant, but as something close. They talked about familiar places, favorite foods, and people waiting to see the child again. The child listened with interest, sometimes adding a thought of their own. The nurse began to see the family not as visitors, but as partners in care. She asked questions, not medical ones, but simple ones. What helped the child feel calm? What stories did they like? What made them smile? The family answered openly, surprised and grateful for the interest. These small conversations changed everything. The nurse found that her work felt different now, less like a set of tasks, more like a shared effort. She still followed every rule, every guideline, but she carried them with more flexibility in her heart. One evening the child laughed. It was sudden and light, triggered by something small, a playful comment from a family member, a silly face, a memory shared at the right moment. The sound filled the room, and for a second everyone froze, as if afraid it might disappear. The nurse felt her eyes sting. That sound had been missing for so long that its return felt almost unreal. She turned away briefly, pretending to check something on the chart, giving herself a moment to breathe. From that point on, progress came more steadily. The child began sitting up for short periods. They asked questions about the machines and the room. Fear no longer ruled their expressions. Even when discomfort returned, it no longer took over completely. The nurse continued to observe carefully. She knew better than to rush hope. But she also knew that healing was no longer stuck. One afternoon the family mentioned the medicine woman again, not asking for another visit, but speaking with gratitude. They believed her work had helped guide the child back. The nurse listened respectfully. She did not argue. She did not explain. She simply acknowledged their belief. That, too, was new for her. As discharge plans began to take shape, the nurse helped prepare the family for what came next. She explained wound care, signs to watch for, and follow-up visits. She made sure they felt confident and supported. The family listened closely, asking thoughtful questions. They wanted to do everything right. On the final evening before the child was cleared to leave, the nurse visited the room one last time during her shift. The child was awake, sitting up, talking quietly with their family. When they saw the nurse, they smiled. "Thank you," the child said simply. The nurse swallowed and smiled back. She told the child they had been very brave. As she left the room, she felt changed in a way she could not fully explain. She knew she would return to her routines, her training, her busy days. But something had been added, not taken away. She had learned that healing could be shared. In that room over those days, science and tradition had not fought for control. They had stood side by side, each doing what it knew how to do best. The day the child was ready to leave the hospital arrived, quietly. There were no loud announcements or celebrations, just a steady feeling of relief moving through the room like fresh air. Morning light filled the space, and for the first time since the accident it felt like a beginning instead of an ending. The child sat up in bed, dressed in clean clothes brought from home. The bandages were smaller now, carefully placed, no longer covering as much as before. The child moved slowly but with confidence, no longer afraid of every small feeling. Their eyes were bright, curious again, and when they spoke, their voice carried life instead of hesitation. The family gathered around, helping where needed, smiling often, sometimes laughing softly. Their faces looked different now. The tight lines of worry had eased. Their shoulders were no longer heavy with fear. They still felt careful, still protective, but hope had returned fully. The nurse entered the room with papers in her hand. She explained the final steps in a calm, clear way. She went over care instructions again, even though she knew the family had already listened closely before. She wanted to be sure they felt ready. The family asked thoughtful questions, showing they understood the responsibility ahead. They wanted to do everything right. They thanked the nurse again, not in a rushed way, but slowly, with meaning behind their words. The nurse felt something warm rise in her chest. She looked at the child, now standing with help, and remembered the quiet figure who had once stared at the ceiling without response. The change felt deep, not just physical, but personal. She realized that this experience would stay with her long after the room was empty again. Before leaving, the family asked for a moment alone. The nurse respected that and stepped out. Inside the room, the family formed a small circle around the child. They spoke softly, offering words of gratitude and reassurance. They reminded the child that they were safe, loved, and never alone. They did not perform a ceremony. They did not need to. What mattered had already been done. When the nurse returned, the child was ready. As they moved through the hallway toward the exit, the child held onto a family member's hand and looked around with interest instead of fear. The hospital no longer felt like a trap. It felt like a place they had passed through and were now leaving behind. At the doors, the nurse knelt slightly so she was at the child's level. She told them to be strong and to remember that healing continued even at home. The child nodded seriously, then smiled. "Goodbye," the child said. The nurse watched them go until they were out of sight. Afterward, she returned to her duties, but the day felt different. She found herself thinking more deeply about her work. She still believed strongly in her training and the science behind it. That had not changed, but something had expanded. She had learned that listening was as important as treating. That fear could slow healing as much as injury. That families carried knowledge too, even if it did not appear in textbooks. In the weeks that followed, the nurse noticed changes in herself. She asked more questions. She paused more often. She paid attention not just to symptoms, but to expressions, tone, and silence. She learned to respect what she did not fully understand. Sometimes she remembered the medicine woman, her calm presence, her careful words. The nurse did not try to explain the experience to others in dramatic ways. She did not need to. It was enough that she had witnessed it. The child returned for follow-up visits. Each time the improvement was clear. Healing continued steadily. The child smiled easily, spoke freely, and showed no signs of the deep fear that once held them still. The family remained attentive, confident, and grateful. During one visit, the child recognized the nurse and waved. That simple gesture meant more than any thank you card could have. The nurse smiled back, feeling a quiet sense of pride, not in herself, but in the shared effort that had brought the child to this point. As time passed, the story became something the nurse carried inside her rather than something she talked about. It shaped how she approached new patients, especially those from backgrounds different from her own. She learned that care did not have to erase culture to be effective. It could make room for it. The family, too, carried the story forward. They spoke about the hospital not as a place of fear, but as a place where two worlds had met without harm. They taught the child as they grew about strength, balance, and the importance of being seen fully. The child grew older with scars that faded over time, but lessons that stayed. They learned that healing could come from many places. That help could arrive in different forms. That being open did not mean being weak. Years later, the nurse would sometimes think about that small hospital room and the quiet turning point that happened there. She understood now that true care was not about choosing one path over another, but about walking together when possible. The story did not belong to one person. It belonged to the child who found their way back. It belonged to the family who trusted both love and patience. It belonged to the nurse who learned to see beyond routine. And it belonged to the understanding that healing at its best honors the whole person.